So here in Newcastle, we introduce the process of transition at about age 14. We will generally have 2 or 3 transition appointments prior to the patient then transitioning after their 17th birthday. And then they have that as their graduation clinic where they then graduate to us from Paediatrics. And we will then follow up them 6 monthly, annually, whatever the requirement is in the adult outpatients. There's a lot of benefits to introducing it early. It gives the patient enhanced support throughout the process. This can include getting some guidance, answering questions, and addressing concerns that they may have, which that in turn reduces anxiety and stress to the patient, and not just the patient, their families as well. A lot of people struggle to come to clinics if it's a morning clinic or an afternoon clinic, and we've looked into that. So we now do clinics in the early evening. So the clinics start from 5:30 and run till about 7 o'clock. And that's then allows patients who may be at college or at sixth form to come and attend clinic once they're finished. We also do clinics via Attend Anywhere because we cover quite a big geographical area here in Newcastle. And some of our patients do live a good hour and a half, 2 hours from the hospital, so it can be difficult for them to get here. I would say one of the common concerns we get is from parents querying where, if their child is admitted to hospital, where the child will be placed. Well, they're not a child, they're going to be an adult, but where they'll be placed following the transition process. And a lot of our patients have very complex needs, and the people that know them best are their parents. And they get concerned that they're not going to be able to stay with their child and not be able to support them because they're a young adult. They will go on to the adult wards, but a lot of the time will be able to place them in a side room where their parents can stay with them or their carers can stay with them and support them. We work closely with our paediatric team. We always have, which is lovely. Even just this morning, there was some advice that I needed about a patient who suffers with anxiety coming into hospital. And I thought, oh, maybe that's something that the paediatric team are familiar with. The great thing now is that we do start this process so early. The patient and their family and carers have got 2-3 years to get to know us before they're actually going to transition to us. So that gives them time to be familiar with the service, which is mirrored to the paediatric team. It's just the adults. To reassure someone who's about to start the transition process, I would say when you come to your first appointment, come with any questions. Don't be scared to ask any questions. We're there to put your mind at rest, to ease the whole process. So anything you want to ask away.